WNBA rookie sensation Cameron Brink unfortunately appeared to suffer a pretty serious left knee injury on this play. And in this video, we're going to take a closer look at the mechanism, the anatomy, and what I think unfortunately happened here in this moment. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal on this channel is to help teach you about the medical side of the sports world. So of course, here with Cameron Brink, we're dealing with her left knee. And I'm going to describe the mechanism of what I see first. And then if those have watched my videos before watching this, I want you to try to think of what you're anticipating I'm going to say in terms of the injury, because I'll describe what I'm seeing. And hopefully you've seen this enough times to kind of understand what I'm concerned about here. So here we see Brink driving in, and there's a couple of things to just pay attention to before this play develops. Number one, technically this would be considered non-contact because nobody slams in against the side of her knee, but I would call this indirect contact. So the indirect contact is when she gets this bump from the defender. That bump from the defender throws off her body's proprioception enough to where now it's this external unpredicted stimulus that her body has to adapt and respond to help keep her ligaments, to help keep her joints nice and stable. So not direct contact like football coming in, not totally in the open field or the open court. Non-contact, we'll call this indirect contact. So then the next thing we see is the landing on a relatively flat left leg with the knee in a relatively extended but slightly flexed position. Whenever someone lands with their knee completely flexed, meaning like 90 degrees or in a more neutral position, that's going to actually put some laxity on the ACL and is not a position where we see the ACL tear. Similarly, if you're completely locked in extension, often we're not going to see an ACL injury unless there's an external force kind of coming in from the side. But here, this is kind of that perfect amount of flexion that we see in the knee that can unfortunately lead to this specific type of injury. So then what we see is, look at her trunk first. So as she gets hit here, the position of Brink's trunk is leaned over the injured side. That's one pattern we see consistent with this specific type of injury. The next thing we're going to see as we kind of go through this replay is her knee drops into what we describe kind of grossly as this dynamic knee valgus. So the knee is going inward right there. That inward position, that inward movement is valgus, as opposed to the knee going outward is going to be varus. So we see the trunk leaning over the affected side of injury. We see the knee dropping into this dynamic valgus position. And what this is all going to do is create a series of torques and forces on the knee that put one particular ligament at high risk. And if you guessed ACL, that's what I'm concerned of, is I think a high probability, a high chance of, unfortunately, an injury to her ACL. The other thing that we'll see with an ACL tear occasionally on video replay is if you think about what the ACL is actually doing inside the knee. We can go look at our biodigital anatomy tool here, and if I zoom in on the left knee, there's going to be four major ligaments around a knee. So on the inside, you're going to have the MCL stabilizing against that valgus stress. On the outside, you're going to have the LCL, lateral collateral ligament, and then on the deep inside portion of the knee is going to be the ACL running from the front of the tibia to the back side of the femur, and then on the back side, we're going to have the PCL running vice versa. So the ACL, if we look at the knee from the side on, is running in this direction. So part of what it's trying to do is prevent the shin bone, the tibia, from going forward relative to the femur. So what that means is if you take and you completely sever the ACL, you're going to be able to take the tibia and pull it forward with no stop to that increase in translation. So what we'll sometimes see on replay is actually this shift where the tibia shifts forward when the ACL has torn, and then when the weight comes off the foot, we see it reduce and pop back into that neutral position. So when we look at that here with Brink, in this position, it does look like there's a little bit increased prominence on that anterior front part of her knee. And then as the weight completely comes off, we see it go flat. So that little subtle transition right there from that protrusion forward to then that flattening in the front of the knee is concerning to me for also seeing that translation of the tibia shifting forward, another sign concerning for an ACL injury. Remember, there's varying degrees of ACL injury. You can have an ACL sprain all the way up to a complete ACL tear or rupture. But based on the mechanism that we see, everything is pretty classic for the pattern of movements that can be associated with an ACL tear. So unfortunately, that would be my concern here with Brink. Of course, an MRI will be performed to evaluate for the full extent, but the team probably already has a pretty good idea just based on their physical exam testings, based on what she felt. If she felt a pop at the time that this occurred, that would also be concerning. But MRI for the final confirmation of what I fear could be an ACL tear. That's it for the video, everybody. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.